Those last 15 should burn, and the pivot point needs to be right there at your shoulders.
And I called my husband and I was like, well, I found my doctor.
You will lose breast tissue. It's just a natural atrophy of the breast gland. So keep your hand relaxed and it'll take your forearm from getting tired.
So things changed with my husband because I felt sexy again.
We're doing our next FitDoc Recovery Series. And again, this whole point of this series is really to kind of show patients and educate patients like what to expect after cosmetic surgery and training and exercising, relieve some of the anxieties from people who've gone through it. So I want to welcome my two guests today, my patients. This is Brittany and then Kendra.
Hey.
And so the topic of today is breast augmentation, women with implants, and we're going to take them through a workout for shoulders. So I'm a big fan of shoulders. You know, women who've always had concerns like, I don't know what I can do after augmentations. Well, I'm going to show you exactly what you can do and what you shouldn't do. We'll go through some of the top 3 exercises I don't want you to do when you have implants. So these girls have kind of lived it and breathed it. They actually have a hobby of bodybuilding, which is one of my favorite hobbies as well. And they'll kind of show you a little bit more techniques, you know, what feels right, what doesn't feel right, you know, and we'll talk about their whole experience of before surgery to after surgery, and then now to the point where, you know, they're both over 2 or 3 years out now. So we're gonna have a great workout today. The idea for training after exercising, especially with your implants, is not to overdo it. We're not trying to kill yourself. It's all about controlled weight training. I'm a big fan of weight training. And so we're gonna do everything about safety. And again, longevity is a big aspect of having implants when you are training. So we're gonna get to it. We're gonna start on some machines first. And these girls are gonna kind of show you we're gonna kind of just walk and talk basically during the whole workout. And we'll be talking a little bit about their experience and then their life now and how it's been different since their surgery. So here we go. Special shout out to my man, East Texas Fight Camp, for hosting our series. They are just incredibly generous for hosting us. This is a great facility. We got boxing, we got group fitnesses of all different kind of things. Great equipment and different modalities of fitness, which I'm a big fan of. So anyway, thank you again, East Texas Fight Camp, and let's get started. Let's grab some 5s or 10s. We're gonna just kind of get your shoulders a little bit warm. So nice and light, we're gonna do a little bit of fronts. We're gonna do some sides here, like that.
Do you want us here?
I don't care where you are,
Okay.
wherever you like to be. Just get comfortable. We were talking a little bit earlier off camera, Kendra. So you're like, what, 3 or 4 years out now?
4
right?
years.
4 years?
Yeah, just that.
Yeah. So the definitely you kind of, I guess your brain kind of gets accommodated to having implants. You're not quite as noticing it like when you first had surgery, right?
Right. Yeah, there's still some limitations that I can feel when I work out, but for the most part, I feel like I can do everything I was doing prior to getting them. So,
Yeah, for sure.
Yeah.
Great. How about you? Like 2-3 years out right now, right?
Coming up right on exactly 3 years.
3 years. Very good.
Yeah,
All
so
right.
I competed once prior to having the implants, and then now it's been 3 times after.
Okay. Well, good. So we got some fronts and sides already?
Yep.
Well, good. So what I would encourage y'all to train, I'm gonna kind of put y'all through the FitDoc
Okay.
training session. So
Love it.
I like to kind of keep our moving. We'll be moving constantly. So we'll be doing a little bit of shoulders, you know, everything for bikini for you girls. Y'all do bikini stuff. So kind of do like a little bit of like glute pump a little bit, just kind of keep blood flow going. We're not going to be doing legs today, but it's really just going to keep moving. Okay?
Okay.
So y'all can put that down.
Okay.
Corey's a big fan of the curtsy lunges, right? Have you seen those before?
Yes.
Yeah. You know what I'm talking about?
Curtsy? Yep.
Yep. So it's a great exercises for lower body, helps with the core as well, as you guys know. You know, the way the tension is on your tie-in and your hamstring, your glute. I think it's a great thing for bikini specifically, but also really for core stability. So I like to get in the habit for training. You know, Corey is a big fan of this too, is be doing something different, a different muscle group. While your shoulders are kind of recovering from the lactic acid, we can keep your heart rate up. You want to keep your heart rate around like 100, 120 consistently, and then go back into whatever you're training for the day. Okay? So it's good. Let's go and do it like a set of 20, and then we'll get
Do you alternate? Or
whatever.
stick to
Alternate. I forget what Corey does, but whatever makes you happy.
I feel like it's very me to, like, why we would not be at the same.
Kendra, your mom of 3?
Mom of 2.
2.
Yeah.
Brittany?
2.
2. So me too. I got 2 girls. And you have a boy and a girl, right?
I have a boy and a girl.
Yeah.
My oldest
Britt?
one's my girl.
2 girls. And we were neighbors for 8 years.
Yeah.
So our kids are close.
Kind of grew up together a little bit.
They're all 2 years apart. So.
Yeah.
Very much. Well, she threw my baby showers. Like we, we were very, very close. Yeah.
Nice. Okay, we're gonna get back on the shoulders here. And so we're gonna do seated stuff now, okay?
Okay.
And we're gonna talk about seated stuff for both of y'all because, you know, first of all, this is exercise. When you're seated, you kind of take your core out of most of the concentration of your brain. We're sort of focused really on your shoulders, right? So it kind of keeps your body honest. So we'll be working more the shoulders. So what we're gonna do a couple things. We're gonna be doing fronts here, right? So just nice and controlled, and you hold and then down. Nice good tempo like this, and then down, and then you come to the side, and then same thing, okay? So we're gonna do 15 to the front, and then 15 to the side. And then for you girls, since y'all are out of, you know, recovery phase now, we're gonna be working out over your head, right? We're gonna be doing shoulder presses. So we'll be doing, front to the side, and then this, okay? So this will be the last of the 3. We'll do 15 reps of the Eve motion. If you girls remember when I told y'all through the surgery, I didn't want you lifting anything over your head. You remember that?
Yes.
For the first 2 months, I did not want you doing anything over this, right? So this was a no-no. Remember that? And then also, you know, chest, we'll talk about that over here later, but definitely anything over your head was a no-no the first 2 months after augmentation, okay?
I feel like I felt it, like after I was released to do it. I was okay after 2 months, but I still felt it.
Right.
And there was like a little bit of pressure there, like, am I gonna mess something up?
Right. Yeah, and the reason for that is that remember I told y'all at 6 months, that's when everything's kind of done. So at 2 months, especially my athletic women who are used to training a lot, your muscle tone is higher. It's just a higher muscle tone. So what happens, your chest is not, the chest muscle hasn't completely relaxed yet. And so that's why you felt that still at 2 months. But you're not gonna hurt anything at that point. But so that's when you start going to do your shoulders, and you start doing the lat pull downs, right? You remember all that?
Yep.
That's 2 months is really kind of get you back to normal everything at that point. With that, when I know you're not gonna hurt anything, okay? So let's go and get into shoulders now, and we'll do those. So 5, 10s, whatever you're comfortable with. As far as intensity of this exercise, you know, this set, those last 15 should burn.
Okay.
This one right here, this 15 should burn. So pick a weight that you feel comfortable at that point, okay? Perfect tempo. Right, so one of the techniques for, especially in bodybuilding, it's more about quality and intensity of the exercise versus jerking. So, you know, jerking movements, you're gonna get prone to injury, correct? And then the second thing is your muscle will work a lot harder and more efficiently if you have to put it in a controlled tension. So we're gonna go through some things where we're gonna kind of change tempo, we're gonna change tension dynamics of some of the exercise we're gonna do. You know, some people will consider this like a superset because we're doing really 3 different exercises for the shoulders here. You know, arguably we're doing a little bit of the side here, the lateral delts. There's 3 heads. We have the anterior head, the lateral head, and we have a posterior head. And we're gonna be hitting all 3 of these today. And you girls' shoulders are gonna be jacked.
Boulders for shoulders today?
That's right. Getting boulder shoulders today. All right.
Press.
Yep, press. So these pressing movements, this is a great exercise for really shoulder stability. You're getting your front head, you're getting your lateral head, but you're also getting all the subscapular muscles associated to shoulder stability. It's a great exercise overall for your upper body. And some patients will be like, well, Dr. Morales, it's working your chest too. Minimally. Like your pectoralis major is really, really, really minimally activated here. You can see it like on Kendra here. Can you do that again, Kendra? So this is where the chest muscle inserts on the humerus, right there. So this is her chest muscle. She's working it a little bit, but it's not the primary muscle. This is more like we call it tertiary muscle with a third helper. Most of the tension and the weight is going to be on your shoulders. Did y'all feel the burn a little bit?
Yeah.
Okay.
Yeah.
But I no longer feel the tension in my chest.
Right.
Like the first 6 months or so.
At 2 months for sure, you would have felt that tension here because the implants again are a little bit higher. That muscle still kind of in that has a muscle higher tone, specifically for women who train a lot. Even more so with like bodybuilding women, you know. People CrossFit, you know, yoga, not so much. But really people who weight train, you're gonna have a higher tone. So I always remember telling you this, at 2 months, you're gonna be like 60% there as far as your final shape, and then 6 months will be 100%. My athletes typically are like, at 2 months are like maybe 50, 55%. You're a little bit behind.
Oh yeah.
But everybody gets there, you know? So it's just a natural evolution of the augmentation, okay? All right, we're gonna go do some lunges, walking lunges. We're gonna go all the way to the end and walk back.
I felt like I could tell for a long time. Mine almost looked like squares. Like my body was just like holding them. And then probably about 6 months, my muscles kind of released them and they look normal.
I think I probably told, this is a very common thing for me to say, like when you first see your breasts, you're gonna be like, what is this, right? They're like high and tight and swollen, and they look a lot different than they are at 6 months, right?
Yeah, they were like, I call them Franken boobs.
Well, you guys had told me to take daily pictures, and so like if I felt like they didn't quite look right, I'd go back to like week 1 and be like, oh, they've really settled in.
Yeah, it takes time. All right, let's get back on the shoulder stuff. So we're gonna do 3 rounds of this. Just a side note for you girls, since y'all train shoulders a lot too, is that shoulders are a kind of a fast twitch muscle. So I would discourage you from doing heavy weights. You need to kind of be on more on the lower weight side, higher reps. It's about getting blood flow into the muscle. You really want to pack that blood flow into it. And then that's how most shoulders respond better, especially for women in my opinion, is you really want to pound that blood in and force it in, high reps, get that burn, and then you'll get that, you know, the really crazy boulder shoulder look.
I like that. Didn't know that.
Good crazy though.
And again, it decreases your risk of having injuries. So if you ever had a shoulder injury, you can look at the bodybuilding guys. You know, I think a lot of that is associated just being, you know, ego lifting and lifting too heavy. And the shoulder joint itself is a very unstable joint. It's not a stable joint. So you start compensating with these small muscles in the shoulders, and you end up kind of getting kind of a setup for injury of different types of muscles. So for you girls, y'all don't need to do that. I just encourage y'all to stay more on the lower reps, focus on quality, focus on tempo, and I think you'll have a much better outcomes with your training. But this one right here should start really kind of burning. Around like 7, 8, it should be kind of burning. Yeah, that's kind of where you want to be.
Yeah.
How does it feel?
After 7, 8, I'm shaking.
Yeah.
Who needs heavyweights?
You can tell I wasn't talking. I'm like,
and it's not really a lot of weight,
burning,
right?
No,
yeah.
No, 10.
Yeah.
That's all I'm doing.
I tell even some of the guys, I tell you, just give me 10 pounds on each side, and I promise I'll make your shoulder burn real bad.
Yeah.
So let's grab some water real quick, and then we'll jump into more walking lunges. So I just like to comment is that these girls are, you know, very well attuned to hydration. And so one thing with training and exercising, you want to stay well hydrated. So you got to get in the habit of drinking lots of water. And if you can drink somewhere around, you know, a gallon a day, I know it sounds a lot, but if you spread it out across the day, it's actually not that much water. How much water do you drink right now a day?
Right, at least a gallon. A gallon seems low to me. I feel like my body naturally needs about a gallon and a half.
Yeah. How much water do you drink a day, Kendra?
I'm close to a gallon and a half to 2 a day.
Or 2?
Or 2. I chug water. It's my favorite thing.
I know.
Yeah. So most people don't know this about water, like drinking water, is there's a tolerance to it, right? Like when you first start doing, you're like peeing all the time, right? But what happens is your body starts realizing that you're training every day, and that you're building muscle, and you're needing water to maintain your muscle mass. what happens is that the water starts being held in your muscles. Your muscles become more stingy with the water. And when you store glycogen, which is a glucose in your muscles, water is attracted to glucose, and that's why you get more fuller and just more of a better pump, because you're hydrated. You will never, ever, ever, ever get a good pump without being hydrated. Ever. It will not happen.
Yeah.
You got to have water.
Noticed.
So that's like, after a show, you've kind of gone through this, right? After a show, and you're super dehydrated, right?
Yep.
And then you go home, you drink some water, eat some sugar, eat some salt, right? The next morning, you're just like, yeah.
Like Hulk.
Yeah, because
Yeah, the day after show.
it's
Yeah,
like it's this sponge effect, because now you have salt, now you have sugar, all
the
that's going to your
veins,
muscles. You become super vascular, and it's really because that water's been attracted to everything intramuscularly. And so that's why you kind of look like a Hulk right afterwards. You feel great, you're hydrated. So that's kind of extreme version of how important it is to be hydrated, especially during working out. So
I feel like my body, if I lack water, like if I'm low on water a certain day, I will feel like I'm bloated.
Yeah.
And like feel like I look like I have a bunch of water, but it's actually the opposite. Like I need, the more water I put in, the kind of better my body
Correct.
is.
It's water distribution. Your muscles start holding the water. Your muscles become a sponge of water versus your intestines. Does that make sense? So it's super, super important. People ask me all the time, like, how much water do you drink? Because I see my gallon. I take a gallon at work every day, and I drink that every day. And it's just because I train every day. But had I not done that, there's just no way I could go to an hour or two without having to go to the bathroom.
Yeah.
But I'm totally good. Like most of my cases last about 3 to 4 hours. I'm good. Dug down the next one, and then I'm good to go. All right, let's go. So the lesson of the day is to drink your water.
And a lot of it.
Do you flavor yours? Yes, right?
In the mornings, I usually start out with like an electrolyte water. But then during the day, sometimes I'll add lemon. But otherwise, it's just plain room temp.
I drip in, stir, to change the flavor.
Sometimes you need that.
Make it exciting.
So Kendra, tell me it's basically how did your life change after breast augmentation drugs were out? What changed for you?
I'm curious why you wanted to do it.
I wanted to do it because, like we said, I have 2 kids, and they drained the life out of me from breastfeeding. And so I just didn't have the feminine shape anymore. And so I really just did it just to have my more natural look back. I ended up having to get a lift as well, so that kind of helped. But it had nothing to do with the sport or anything. I started just because I wanted to see my boobs back after babies.
How about you, Brent?
Mine was almost identical. I had noticed so much change after breastfeeding. And even the size I picked, or we picked, was really just got me back to what I looked like prior to nursing my girls.
Yeah.
And now 4 years later, I'm like, I could have gone bigger.
I know. He mentioned that.
What did we talk about? We talked about that, right?
You'll grow into them, and you might want bigger. And it was like, there's no way. And now I look at them all the time. I'm like, we might see soon.
So just kind of talking about physiology of breast tissue for women is that when women go through the childbearing process, is that you will lose breast tissue. It's just a natural atrophy of the breast gland, and so it's compounded with breastfeeding, and so you become more deflated after having children, with or without implants. So the common age of breast augmentation is actually like 21, 22 now, and this is before you have kids. And then what happens very commonly within 10 years, you have 2 or 3 kids, and then they come to me and like, Dr. Morales, my breasts are not nearly as big as they used to be. Your implants didn't change. What did change is that you lost breast tissue. And so, it's a little bit different for everybody. If you breastfed a lot, you tend to have more deflation. And you don't regain that breast tissue ever again. It's gone. And then you compound that on top of like weight loss. If you lose a lot of weight, or you get into the fitness bug of bodybuilding and you start maintaining more or lower body fat percent, again, you lose breast fat, right? And so that's what's going to happen is you lose a little bit of breast volume on top of the natural loss of having, going through the kid process. So very, very common for me to hear, after a year or two, people have gotten to, more health and fitness that they tell me, I wish I'd gone a little bit bigger. I think we talked about that before too, right?
Yeah.
Yeah. And I tell everybody the same thing. Usually at 6 months, I would say 1 in 20 would say, I know you told me this, Dr. Morales, but I think I would go a little bit bigger. And of those 1 in 20, I would say maybe half of those will go through the process of just going back and just upsizing it just a little bit more, like another 50 to 75 cc. So anyway.
I feel like through the fitness stuff, I lost even more breast tissue, and so I was just kind of looking to be more feminine again, if that makes sense.
Yeah. All right. Let's go back to curtsy lunges this time.
How would you say life changed for you after your breast augmentation? Things or like things you did things.
Things I wore, I would say, like number one was like confidence. Like it sounds so silly. People always say my clothes fit better, but literally my clothes fit better. Like I felt more feminine, and I was more confident.
It's one of my favorite machines, not necessarily the hoist, but
I've never done this.
This motion
They're
is.
tough. Oh, good.
This is a great exercise machine. You can find these. Hoist makes some, Cybex, Life Fitness, all make a different version of them. But the positioning is very important. So the pivot points, they always say pivot points where you're facing it, and the pivot point needs to be right there at your shoulders. So if you're short, you need to kind of sit up higher on the seat. If you have a more longer torso, you need to either squat down a little bit more. I prefer you just lower the seat, because you want to keep your torso straight. And the idea is, this is more about, it's deceiving. It almost seems like they want you to get really heavy. I would not do that. So stay light, and again, we're going to be very controlled with the weight. It doesn't matter what you do with your forearms, but when you kind of up and then down like this, okay? So it's a nice, good tension. I don't want you to rest. You don't want to rest here and then come up. You want to keep constant tension on your shoulders. On this motion, we're working only the lateral head of your muscle of your shoulders. At 3 weeks from surgery, all my women with augmentation, you can do this one. It shouldn't hurt you at all. You feel tight when you're at this point right here, but you're not gonna hurt anything. So shoulders at this point is good. So we're gonna do this one, and then we're gonna hop on this one over here. This is a shoulder press. So similar to the free weights, machines are great because they're very controlled. It's going to control the motion. It's really hard to kind of get sloppy with it. It supports your back. Again, same thing. We want to keep your arms at a 90. I don't want you doing this one in the front. This is a no-no, right? Mm-hmm. So a no-no for right up 3 weeks, and then same thing for on the sides. So women who build augmentation with me, 3 weeks, you cannot do this. But once you're out, you can do this. But when you do it like this way here, this motion you're actually kind of flexing your chest a little bit more than I prefer. Mm-hmm. This is not one of the top 3 exercises I don't want you to do, but you're incorporating more of your chest muscle. So I prefer you be on this side, okay?
I'm just curious too, when you say flexing your chest, what is the worry there? That you would separate them? So
I've done, I think I've done five videos now, Chase, about the 3 exercises I don't want you doing for when you have a implant under your muscle, like both you girls have. And the first exercise is pressing. So any pressing motion, your primary muscle is going to be your chest muscle. So incline presses, straight down, or this. Any angle of pressing is you're going to activate your chest. And same thing with the flies, right? Mm-hmm. Same thing. You're activating your chest as your primary muscle. And the last one is really more of a stretching, tension exercise, and that's called a dip. So I'm gonna show all these machines here, whether that's weighted dips or machine dips, like this here. You can feel it now, right? Mm-hmm. You can feel the tension. And the anatomy of it is that implant's partially in your muscle on the top half of the implant. And then when you put tension on it, your muscle contracts, and it pushes your implant down and out. Mm-hmm. And I know y'all felt it before, right?
Oh, yeah.
That's one of the things you have to we can talk about that, getting used to that sensation of your muscle kind of squeezing a little bit, it moves a little bit, right? But if you do that for time, and for purpose of training your chest to get bigger and stronger, like you're adding weight, inevitably, you will push your implant down and out, and then I'll have to fix it, which means taking your implant off your lat and putting it back where it should be, right? So that's a problem that comes with training for a purpose of getting stronger and with weight. So all my patients who do like, you know, F45 and CrossFit and yoga and, you know, bodybuilding and stuff like that, you know, I'm okay with you doing body weight. Body weight's not gonna hurt you at all. Like you doing this with body weight, totally cool. I'm okay with that. What is gonna hurt you if you put this on some weight, you know, and you're doing, you know, 100 pounds and you're really trying to, because what happens, especially with this motion here, you tend to go like this. You see what happened? Then it becomes a pressing motion. You see what just I did? This is a little bit different. If you stay ahead, your front delts are working. But as soon as you go back like this,
You get so wide.
the reason people do it like this, because you start engaging your chest, and then it becomes a chest press. Does that make sense?
Sense.
Yes,
Yeah.
absolutely.
So be careful when you're on this machine. Always kind of stay square. I prefer you this way. But that's kind of the anatomy of it, okay? Someone would be like, oh, well, I don't want my implants to, I have my implants I feel like are kind of off the side already, right? A little bit. The anatomy of every human being, we have a round rib cage. So having a natural kind of slope to the side of the chest is normal. When you're on your back, a little side to side, that's normal. Some women are just genetically made a little bit wider. Some have a wider chest bone than others.
I was gonna,
Yeah.
we're built very differently.
Very different. My wife, wide chest bone. Her breasts are a little bit more separated. We can't fix that. It's just the way you're made. We respect the anatomy. You don't want to make them together. What happens? You're going to get a lot more problems. Okay. It's really just augmented to your anatomy, and then staying within the limits of exercising to understand that concept of what happens with long-term training of the chest muscle. Once you're augmented, you do not need to train your chest like ever again.
I haven't since.
I mean,
Yeah.
I get it, and it
Exactly.
doesn't change your physique. It doesn't change your posture. It won't change your structure. For bodybuilding, it's very unique. It doesn't change your proportions or symmetry. Like my wife's in figure, it has nothing. Like her back is great. Her shoulders are great. They don't judge you on striations of the chest. If it's women's physique or women's bodybuilding, yes, they do, and they do want to see muscle mass and striations. So their implants go on top of their muscle, right? And that is, you do not put an implant underneath.
Yeah.
In my opinion, implant longevity for women is better partially under the muscle. Your breast implants will stay exactly where I put them for the rest of your life. They will always stay there because they're being held by the muscle. It resists gravity. There is no really aging, you know, stretching of where that implant lives. When you put an implant on top of the muscle, then the only thing is holding up is your skin.
Yeah. Yeah.
Do you understand? So that's kind of the big difference of aging of women with implants. And so where your implants are, it's hybrid, so you will have your implant stay for the most part for where you are. You will go through the aging process where, you know, your skin will get thinner. And if you have a lot of breast tissue, you'll feel like it kind of gets a little bit looser over your implant. Depends how much breast tissue you have. You won't have a lot of breast tissue, not too much of a big deal. Women have like naturally C-cup, D-cup breasts. They will kind of feel like their breast tissue is kind of sliding off the implant a little bit. That's just a normal aging process that you can't stop with or without implants. Oh, sorry for the tangent, but anyway.
I mean,
We're learning.
I find it interesting. I find it all interesting, and I know going into like our consultation and all, I wanted to know where it was going to be placed and all because I wanted to look natural.
Yeah.
And wanted to kind of get back to where I was.
Yeah.
So it was interesting to me that under the muscle that would give me a very natural look too.
Good. Well, great. Let's. We're gonna split it up. So I'm gonna have Kendra on here.
Okay.
Britt, you're gonna be here. And then we're gonna basically swap.
Swap.
Okay. Stand up for a second.
Yep.
And then reach up just a touch. All right, try that. Yep. So I'll come down a little bit more, Britt.
What am I at on weight? 40?
It's kind of a weird machine. I can't really tell. Is it okay? Is it hard? You want to lighten it up?
Halfway through it, yeah. Yep.
Okay. If you can get 15, get 15, okay?
It starts burning at the end.
All right. How was the weight for you on that?
Good. I could probably go up slightly.
Okay. It's a good feel.
Yeah.
So, switch here. I'm going to increase your weight a little bit. No way. Let's try that.
This I've never done before. The motion is out.
You never done these before?
No.
Okay.
I mean, not on a machine.
So I think you're a little heavy. I'm going to come down with it a little bit. Let me try that. Feel better? I'm going to drop it even more. So when I'm watching you, Britt, when you're doing this, I know I need to drop your weight because what you're doing, you're shrugging.
Shrug.
You're going like this. It's not a trap motion, it's this. Do you feel a difference?
Yes.
Yeah? Okay.
My gym doesn't have something like this. I can do these with free weights.
You could do these free weights. Again, your angle of your arm needs to be, your elbow needs to be right at the front of your torso here, like right here, to make sure you get your lateral head. Once you start doing this, when you put your elbows behind you, what happens, you start moving your rear delt. We don't want that. We're trying to isolate the three heads of the shoulder. We're going to blow out your lateral heads and get those off the tee. And when those are done, your rear delts, we're going to do here in a little bit, you really have no choice but to do all the work. And we're going to kill those things.
Perfect.
Okay? All right.
I've always been told
How was the weight
it's like
for
you're
you?
hugging a ball. It's kind of the
Oh.
Yeah.
Okay.
it's how
Like
you
that.
feel on your arms stuff.
Like I
Does it
almost
make
feel like
sense?
I was like putting too much tension. Oh, it's actually easier without holding the handles. That makes sense.
Yeah, that looks a lot better, yeah.
Form makes such a difference.
So shifting your shoulders on this machine, if you shifted it back, you'll start using more traps. You'll start using this. You see that?
Oh yeah.
But if you shift it forward, right there, and you don't need to grab it.
Like I almost feel like
the,
I was holding too much tension in the handles.
Good? Feel different?
Yeah, very
Awesome.
different. The ball thing helps a lot.
How was the weight there for you?
Good. It was a struggle at the end.
Okay.
Yeah. So things changed with my husband because I felt sexy again. I could wear the outfits that I felt comfortable in, but knew he really liked me in. That helped show off my curves and my shape. So we had a lot more fun date nights and shopping sprees together.
That's probably something that a lot of people think of. Because it's going to improve the relationship.
No, I was going to say I never thought about that going into it. I was just kind of doing it more for me wanting to feel better about myself. But I know my husband could see the confidence change in me, and
I mean,
he supported it.
I saw it
from day one. Yeah.
I mean, I watched you go through that transformation. So like I don't know, 2 months.
Yeah.
I felt like you were just dressing a little bit different. You know, you became more active on social media, and then in 6 months, the next thing I know, you're just like, you're doing photo shoots and all this other kind of cool stuff.
Instead of my t-shirts, big baggy t-shirts, now I'm like, oh, let's go get these like cute matching tops and show it off. Yeah.
I definitely noticed that with Josh.
Yeah. He's my #1 supporter. He usually is the one who buys me everything. He's like, here you go, it's gonna look great on you.
Yeah, I can relate to that.
Yeah.
I do a lot of that.
Doc, what does it mean to you when you hear, patients say stuff like that? That not only do they help them and help relationships or marriages or spice things up or whatever.
I think it's good. I think the procedures I do for people, helps them feel better about themselves, and it gives them a little bit of confidence back. I think they carry that into their lives in different aspects, either with the relationships or you know, how they walk and talk and interact and how they dress, and I think it's very rewarding. I think it's great.
I think it also shows off like a good role model for my kids. I have a daughter and a son, and I mean they both see it. Like, oh, mom likes to, you know, dress cute and look cute, and hopefully that'll inspire her.
Yeah.
To be very confident in herself when she grows up.
Yeah. All right, switch.
Same question for Greg. What did you experience?
I had seen her go through it. Like I feel like for me the confidence thing was obvious. The unexpected that you asked, I didn't realize, like, as far as recovery, how much it would affect my normal life immediately. I'm a mom and a wife first, so as far as putting dishes away, or groceries, or a laundry basket, all of that, that was probably about 2 weeks, or even maybe a little bit longer, that I felt like truly myself again, like I was doing good for my family.
Yeah.
But then, as soon as that came back, and I looked the way I did, I was like, yes, we're good.
Yeah, having to ask for help when you're so used to doing everything by yourself.
Yeah.
That was tough. I would get scolded sometimes by Josh, like, you're not supposed to be doing that.
I think a lot of women, especially like the mom makeover series, we're doing a lot more. You know, I tell them ahead of time what's going to happen. You have like this mom guilt.
Yes.
And you'll feel very, 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 very guilty because you're used to doing everything for everybody, taking care of the kids, you know, taking care of the house, and maybe have a job, but, you know, getting kids back and forth from school, and then you can't do these things. And I'll tell you, don't do it, because you end up kind of hurting yourself. And you're going to be kind of emotional that first week, you know, because you feel like you're letting your family down. They depend on you, and the kids don't understand. If you have young kids, they don't understand. And you got to depend on the husband. Maybe they work too much and they're not home, and then it can be compounded. So, you know, that first week after surgery is very important to have a good support system. You know, whoever it's going to is, help with the kids. You have kids, or, you know, especially kids, right? You know, the mom guilt is real.
Because they want their big hugs, and we're like, I can't hold you right now, so come up to my level, get on the couch, and I'll hug you there.
But it goes away. And then you start seeing things change, start feeling a little bit more, getting more energy back, and kind of feel like your normal self again.
I feel like even though, like, I knew it was there, that feeling was there, I still had a community. I had her I could lean on. I had a friend that went and did it the full mommy makeover shortly after me. But so because I had been through it with you, like, I knew to go check on her immediately.
Right. Yeah. I think a lot of moms just feel they don't want to reach out to help for help. You know, just a family member, someone just kind of help them out. They feel bad to ask people for help, because most of you girls are like super women. Like, you're used to doing everything for everybody, and to have that be vulnerable, you know, it's hard. I understand that, but
I feel like, though, you were clear on why not to do those things.
Yeah.
So I didn't put myself through carrying a laundry basket because I understood why not to, if that makes sense.
But also your husband understood too.
Yeah, true.
Yeah. I mean, he kind of got the talk also, right? He understood the importance of it. It's very, very important. Okay, let's switch. This is the last round, and we're going to do something a little bit different.
Okay.
Let me adjust you just
please. Please.
So hold on a second. Get there. Hold on 1 second, Kendra. Okay. All right, this one's called the AMRAP. You know what AMRAP means?
Did you just
many rounds as possible?
As many reps as possible.
Or reps, yeah.
It's a burnout set. So this will be your third one. We're going to burn it out, okay?
Okay.
So that doesn't mean get sloppy. It means get as much as you can until the burn hurts.
Yeah. The burn, and as soon as you feel yourself compensating the other way.
When you start kind of wiggling and you start compensating, that's when you stop. But the idea is stay focused. The more burns, you really want to focus more on your motions and your hands and your shoulders in space. Okay? All right.
By the time you feel the burn, that's when you're growing muscle, right?
That's right.
Yeah.
So AMRAPs, people will kind of tend to like jerky and you try to go for numbers. That's not the point. The point is you want to make the muscle work. We're doing quality, not quantity. Quality over quantity. Very, very important concept for weight training. Great posture, Kendra. And you're doing great with your core. Good job.
Oh, shaking. Yeah.
Good. How many did you get?
Me? 18.
Oh, that's pretty good.
24.
Nice. Awesome. All right, so now we're going to go over, we're going to kind of show some other exercises that you could not have done in your 2 months.
Probably.
Examples, great examples, like the lat pull down, remember? I told you not to do this, right? And the reason for that is when you do this, what's going to happen is you're going to stretch your chest muscle out, and it's just going to cause a lot of discomfort. So nothing over your head, okay? And if you're like, Dr. Morales, want to do rows, same thing. You end up kind of flexing your chest. It's a natural tendency. It's a natural compensation of the body to kind of balance the tension in your back with your front. And so your body naturally will contract. Again, I don't want you doing that. So
I felt like
at 2 months, you can do it. And this is I think I told you all both at 2 months, but when you first start doing this, right, you're gonna notice is, and I know y'all did, is that when you did this for the first time, I know you felt tension right there. Remember that? And you might even see a band. Did you have a band? Did you have a band? You might take a little band there, right on your chest, right under your breast. But the reason for that is when you do this, all of a sudden you're stretching your chest muscle, and your implant is sitting, on your breast fold. And I have 3 layers of sutures under there that are holding it down. So you'll feel the tension. You're not going to hurt it at 2 months, but you will feel that tightness.
Discomfort a little bit, yeah.
So I wouldn't recommend you try to start doing pulls like at 2 months. It will never feel good. It feels weird. It will scare you. Some people will get a little scared. Some women will get a little bit of a band there and they freak out. It's just suture material, just holding things in. And just try to avoid that first from now. I would start with the rowing. The rowing is a lot more tolerable. You're not going to feel that stretch. You know what I'm saying?
For me, it was the pulling motion for most things that would activate chest, and I would feel not hurt, but just tension that I was worried that I was doing something wrong.
Okay, all right. I'm going to go do some more stuff over here.
I had a couple other consults before Dr. Morales. And none of them just felt right when I went there. There's always something off. So someone recommended me over to Dr. Morales, and just like immediately just his bedside manner, wanting to explain everything. I could tell he wasn't just another number going through his office. And how he's always rooting for us and being since Josh is my biggest support system, he's probably number 2, like I want you to succeed in life. So it's nice just having someone there, or even if I have questions or feel like something was off right away, I could go to him and ask, and he would explain what discomfort I was having, or maybe try a different movement or exercise, since he's very familiar with the bodybuilding community as well.
What would your answer be?
Same thing. I think I interviewed a lot of doctors or went to a lot of consults. I think I kind of went into it like I wasn't going to choose my best friend's doctor just because my best friend went there. And Dr. Morales was the last one that I interviewed, because I remember walking out of there, it was bedside manner for sure. And I called my husband and I was like, well, I found my doctor. Like it just felt so right, and every bit of it. I was actually competing at the time, and so I was very thin and almost no breast tissue. So when I had my consult, he talked me all through how long he would like me to recover, even before surgery. It felt like there was so much care and wanting me to succeed long term, as opposed to just getting boobs and moving on. He wanted me to do it the best way I could. And then after, making sure I was, as I went back into workouts, making sure I was doing everything the healthy way.
So we're finishing out our lateral head and our front head of the shoulders, and then we're start getting your rear delts to kind of finish it up. Okay.
Okay.
So the first thing is we're gonna do, I don't know what they call these, but these things here. You know what that?
Steering wheel.
I don't remember what they call
That's
that.
what I call
Anyway, we'll be doing that. Okay. We'll be doing this, and the other person is me doing this. And so variations of a lateral raise. Okay. So for you girls bikini, and really for all women with shoulders, your width of your shoulders will kind of help enhance your taper. So you want a little bit more on your lateral than your front. So you can do this with the D handle. This. Y'all do that, right?
Yeah.
Yeah. I'm gonna show you something different. I think this is great.
Yeah, I was gonna say.
So use a soft strap. Okay. This is for ones you're doing the ankle stuff, right? You put your wrist into it. Okay. And now the pressure is on your wrist, not in your hand.
Yeah,
and so your forearm is not going to be working anymore. And the only thing that's going to work is this stupid thing here. Okay? So keep your hand relaxed, and the angle is going to be completely flat in front of you, and the hand to space is going to be just about 15 degrees to your side. Okay? It's not this. When you start doing this, what's going to happen, you start feeling your trap work. You'll be just in front. All the weight's going to be right on your wrist joint. Okay? And this is the motion here. And then you're going to do 20 here, flip to the other side, but keep your hand relaxed, and it'll take your forearm from getting tired. Does that make sense?
Yeah.
Yes, absolutely.
And I think you'll
favorite.
If you're gripping anything, you use your forearm. So
yeah.
that
So again, we're trying to isolate the muscles, this with bodybuilding, right? So again, especially women, y'all have big forearms. You don't need to be working your forearms.
Yeah.
Again, this is going to isolate. I think you'll feel a difference if y'all never done this before.
Yeah.
And still,
It's a super cheap attachment. I think it's just a great thing. So we'll come to swap.
weight.
So again, it's more.
Yeah.
I want you to burn it out. So I want you to do 20 for these. Okay. So nice, good hold here. Again, good posture. The angle is just 15 degrees off of your true side. Okay.
Okay. What do you want to do first?
I'm closer here.
Here, I'm gonna put you down here. Let's do them both together. I think that'll be faster.
All right, there we go.
Oh, there's two. Yeah.
No, well, he's setting that up. Let's do these.
Yeah. There we go.
Where are we driving to?
Look at each other? No.
We're driving through the Houston traffic.
Yeah, you're weaving. Were you counting?
Yes.
It's kind of neat. You kind of see how they don't look like they're doing much, but they're actually doing something, because what's getting the front head and the lateral head are constantly like different tension, and you can see your muscle fibers firing. Okay, so again, the strap is going to be right at your wrist joint.
Same way, or look at each other?
You can look into my beautiful eyes.
So you feel it?
Oh yeah.
I can see it. You feel the difference?
Yeah.
Then doing the D handles?
Yeah. I like these better.
Yeah. Very isolated.
So you're gonna do 20, and at the very I'm going to do at the end of 20, you're gonna do 5, where you're gonna be doing just
Babies.
this little baby partial at the very, very bottom. Okay.
18.
Okay.
Okay. Good. Right here.
Yeah, that's a burn.
Feel the burn?
A little bit.
Yeah.
I When he says, "Are you feeling the burn?" and I can't answer, I'm like, "Yeah."
Well, yeah, just automatic yes.
Is it normal to have one shoulder stronger than the other?
Yes.
Okay.
It's very normal to have a dominant side.
Is it usually the side that you write with?
That is correct.
Yep.
Interesting fact about the human anatomy is that on your dominant side, you're not only stronger, but your bones are actually longer. Your arm will be a little bit longer. You know, we're talking about like a millimeter or two typically. If you're right-legged, you know, to kick a soccer ball with your right leg is typically a little bit not only thicker, got more muscle mass, but typically it's a little bit longer, usually at the femur. So this is a great set because what it does, it really kind of isolates the motion there. And the reason you do the bottom ones is because there's nothing really helping you, that muscle out, going from here to here. There's nothing. Like from here to here, what's going to happen, you start compensating under, you can feel it. You start feeling the trap. And that's when the other muscles are trying to help out. But really at the bottom, I really want you to focus on just kind of burning it out, right? Because this has no help.
Yeah.
And that's really the point of this exercise. Okay? All right, let's do those again.
Flexibility?
Where?
We'll look for it. I don't know. I would have to look for it. All right, now where are we driving?
Are you supposed to have hands straight across from each other, or?
At 9 and 3. 9 and 3. Yep, just like that. All the way over to 12 to 6. There you go.
That's why my traps are really big too. I'd always overcompensate.
Yeah, you have a tendency to compensate with your traps. You notice that?
Because you start to shrug?
Yeah.
Yeah.
Oh, it hurts.
All right. You should really feel it burning there. You can see it.
I know.
Look at the striations. Damn. Okay.
It looks good, I promise.
Like I can't even talk.
It's a good burn. What do you think, Kendra? You like that one?
Yeah.
Feels good, right?
Because I always can tell, like when I do anything with grip, that's usually my weak point because I put a lot of tension in my grip.
Yeah.
So these definitely help isolate the shoulder. Burns so bad.
You can also do these with bands. I think bands are okay too. So you just anchor something and put the band on your wrist.
Inside. Oh yeah.
Kind of the same thing.
I like that.
Yeah.
So the bands is a different tension than, you know, cables, different tension than weights.
Yeah.
So play around with it. Like 1 week do bands and 1 week do, you know, cables, or kind of switch it up. You want to constantly trick your muscles to feel different tension.
Yeah.
You know, but again, try to stay on the lower end of weights, increase your reps. You really want to get your muscles to be really just full blood. So. Okay, all right, we're done with this. We're going to be doing, now we're going to get your rear delts smoked. So most gyms will have this machine, and y'all probably done this, they're called face pulls. So basically you're going to be, we're trying to do your real delts, okay? So we'll be going like this, all right? This is the motion here. It's not a bicep thing, so try not to focus on your biceps. So keep your hands down. It's called pronated.
Okay.
And then come straight across, okay? The more you kind of go like this, the more you're gonna get your traps.
So underhand is wrong.
And if you do it like this, again, most people tend to do this with your biceps. I would do more straight like this, okay? So it's just face pulls. If you want to kind of do like this is fine too. You'll feel better. Everyone's a little bit different what feels better, I think, but you need your hands a little bit above your head as far as the direction of the tension, and pull this way, okay? Straight to your face. Don't go like this. Once you start doing this motion here, you start using your teres and your back. We're not doing back. We just want this little baby muscle. And the most tension this muscle has is when your arms are all the way in front of you.
Oh,
Okay? And this muscle works from here to about here. That's about the motion of your rear delts. From here to here is actually your rhomboids, which is the muscle in your back, and then your lower inner traps. So like on you, your rhomboids are here. Your lower inner traps, this big triangular muscle, is right here. So it's pulling your shoulder blades this way. So you don't want to, from here, again, here to here is more inner trap and then rhomboid. Here to here, I promise you're going to feel a lot more tension in your rear delts. And so you almost consider it as partials.
Yeah.
Okay,
Gotcha.
so
Yeah.
I would just kind of stop it at 90 degree for your elbow, and that's pretty much your stopping point.
Okay.
Does that make sense?
Yeah. Yeah.
It's not a shoulder thing, it's, I want your shoulders out. Not like this. Out.
Oh.
Do you feel the difference?
Yes.
Even just
Like I always feel like rear delts are the hardest ones to work too.
Oh, we're gonna smoke your rear delts today.
That's fine by me.
okay.
No. Yeah. Yeah.
Okay.
Too much. Go. Right there. There. All the way out. Straight. Stop.
Oh.
Stop. Good. All the way out. All the way out. Don't shrug. Let your shoulders out. You feel it?
Yes.
I can see them working. You feeling that there?
Yeah.
I'm seeing them work. Again, the muscle is a very small muscle.
I feel like I had to step back a little bit to
Yeah.
like get the full.
It's more of the
extension.
stretch. You'll feel this once you feel that muscle stretch. You're going to be working it, but it's a very short arc of motion for the rear delt.
Yeah, that's completely different. I can feel that.
So your plane is right. I see your muscle working, and you're not engaging this, which is important. So once you start rotating your scapulars in, you're doing it wrong. You're doing too much. Make sense?
Yeah.
You feeling it?
Oh.
Okay.
Oh,
Good.
yeah.
Awesome. All right. And the next thing is we're going to do this. So same motion, okay? We're going to be your hands all the way in the front. They're going to be touching, okay? And I want your shoulders out. You see? Not this. This. We're going to completely disengage your rhomboids and your inner traps. You understand? So this, and then we're going to do the same motion. We're going to do 10 of these, okay? We'll do 10, and then we're going to do big circles. 1, 2. You see where my shoulders are? I'm out. I'm not shrugging.
Yeah.
Big circles. Okay? We're going to do 10 of those. So 1 is all the way down, and then all the way back up. And then when you're done with that, I'm going to do this.
So that was the same movement as the first, or
No,
that's
it's
slightly
a
smaller?
much
the
it's
partials on the
a
partial.
partial of a partial basically.
Okay.
So the first one is more like this, right?
Gotcha.
This one is going to be like this.
Okay.
And if you do it right, this is going to be really hard. Okay? So
I believe you.
So do you want to go first?
this one's geared a little bit different, so yeah. We'll try the 10 and see how y'all do with that. Who wants to go first?
I don't mind. Just watch my form.
This is all real delt. If you do 5 sets of this just by itself, your rear delts are smoked.
Okay.
We're only gonna do 2.
This was 10.
A little bit higher. There you go. That angle.
Yeah, oh yeah.
You feel the difference?
Yes.
A little bit higher.
I was going 10.
That's 10. Okay, big circles. Yep.
And then back.
Yep. 1. 2. 3. Perfect form. Feeling it yet?
Yet?
Big circles. Beautiful. Good. Shoulders out. Good. Good.
Okay.
Okay. And then little baby ones. Yep. A little bit higher. Right there. Right there. You feel them working?
The answer is yes. I can see it in her face.
Very good.
Those babies at the end. Ooh. Oh. Yeah. Ooh.
Look at your little riddles. It's so cute. It's so jacked. You see that pump already. Good. No, flat out. Out. Okay. Now go. You feel them working?
Yep.
This is the posture of your back you need to keep, okay?
Okay.
When you start shrinking, that's where you're going to get out of alignment. You're going to be not working this. You'll be working this. We don't want to work this. We want to work this. Maybe 10. And by keeping it perfect, staying just flat, just like that. Good. Big circles. Good. 2. 3. Good. Keeping your core tight. Perfect. It's good. Who's that?
This is 8.
So you're burning pretty good at this point.
Yeah.
Okay. Okay, and then again, I'm going to go all the way out. Okay. Perfect. Boom. Burn it out. This is where you can kind of finish it off. If you can get through 10, you can squeeze out another 5, even better. This is perfect. I see your muscle working hard. This is good.
Oh yeah.
Feel it?
I do.
These are called the Ryan Workmans.
The Ryan Workmans.
That's what I call them. And my first coach ever, his name was Ryan Workman, and he taught me this, and he blew my mind when I first did it.
Yeah, that's
And it doesn't take a lot of weight at all.
Right.
Like that's no weight.
Yeah. And I'm always looking for like different things for
Yeah,
my rear delts too.
Yeah.
And
Yeah.
I like this.
Do you usually push that towards the end of a shoulder workout?
I do.
I usually end
yeah.
with rear delts.
Yeah.
I like to end the workout with the rear delts because they tend to kind of help out a little bit with other exercises, in my opinion, on the shoulders when you're doing shoulders. And it's kind of pre-exhausting them, so you get a little more out of this exercise than doing it right off the gate.
Yeah. When the rest of the shoulder is tired.
All right, ready? Doing a great job with the posture. Core tight. Good arch. Not too far back. Right. Let go of your shoulders. Let them out. There you go. Not too far. Stop there. Good. Perfect. This is a lot better. You're shrugging. You don't want to shrug. Do you feel the difference when I kind of just adjusted you a little bit?
Oh yeah, absolutely. So
these exercises I'm teaching you, all this can be done, with implants. It doesn't really matter. Anything shoulder, for the most part, you're good to go. Just try to avoid doing like, pressing, because again, the natural tendency for this front press is that you arch your back and you start getting your chest involved.
Yeah.
You said dips were?
Dips are a no-no.
No.
Yeah, dips are a no-no.
No more dips.
All right.
Last set, best set.
I was crossing, right?
Yeah, crossing.
A little bit hard. There you go. Bend your elbow a little bit more. That's it. Out. Let your shoulders out. Feel it?
Yep.
Big round circles. The bigger the circles, the more your rear delts are going to be really pissed off. That's what we want. Good job with not contracting this. Good job. Trying to give you the feedback of that you're working this muscle. Makes you focus on the tapping.
I was like, it makes me focus on
Yeah, absolutely.
Another Reiner Workman thing.
Makes sense.
He taught me.
That's why Josh does it to me when he lifts with me.
Yeah.
He'll start poking whatever.
Yeah, where you're supposed to feel it.
Yeah.
Good job.
Thank you.
You survived.
Good job.
Thank you.
Let's see these shoulders.
Why do you make us lift our arms?
Anyway, great workout.
Yeah.
Hope y'all learned something.
I learned lots of things today.
Like every bit of it I learned.
Yeah.
Yeah.
Thanks for coming in and helping me out with the kind of instructions on how to get people back into exercising, women with implants. Shoulders, I love shoulders, women with implants. All good to go with shoulders, right?
Yeah.
Yes.
I think y'all learned that. And then now y'all been so far out, y'all never had issues with any of that, right?
Right. Nope.
Perfect. So anyway, that's it. That's a wrap for the FitDoc Recovery Series. We did shoulders today. So give these two girls a special shout out. We got Brittany and Kendra. Go follow them on Instagram. They have some great profiles. They're always, teaching and showing training and personal bodybuilding hobby. Really great at it. And so anyway, stay tuned for the next one. And the next one's gonna be the tummy tuck. So getting people back into the gym after a tummy tuck at 3 weeks, 2 months, and a year. So thanks again for following. Don't forget, like and subscribe. Drop me a comment down below and give me some more ideas what you want to hear. Thanks for following.